there are a huge number of technological influences on the patient and healthcare professional relationship. If you just take the device that most of us wear on our wrists, certainly there have been examples already, and in my book I talk about an example for a cardiologist, a heart specialist, who had a phone call from one of his patients, and the patient said, based on the device he was wearing, he thought he was in atrial fibrillation, which is an irregular heartbeat. And in fact, when he came into the doctor's surgery, he was. And I think that that is quite a significant change in the relationship, the dynamic between patient and healthcare professional, and one that we need to get used to, because I think as we all start wearing devices and we are all being monitored 24/7 potentially, that data can play a big part in our relationship that we have with our healthcare professionals moving forward. And I think it should. I think the idea of virtual consultations rather than face-to-face consultations, technology as it's been utilised in many other industries, could have a huge role to play in that relationship between healthcare professional and the patient. I don't necessarily think they're bad changes either. I think it's exciting, particularly for people who live in rural areas, the idea of having a virtual consultation with a specialist that they wouldn't have had access to unless they'd travelled to them, perhaps for days or at least an overnight stay. The idea of having, a 45-minute or an hour's time with a specialist at very short notice, potentially, is a life-saving and a changing event that could change the management and certainly speed up the decision-making process for both patient and doctors. And so I think technology, myself, I think it's very exciting, the idea of technology having a bigger role to play. But what I would say is that the relationship between people, the human-human relationship, still needs to be at the forefront. Technology is an enabler. It can certainly streamline processes, streamline the communication of information, and streamline consultations very, very quickly for us. So that pathway from first symptoms to diagnosis could be very, very short, potentially as related through technology. But the most important thing still is humans caring for humans. And I think that that is the fundamental part, or the care part in healthcare, and that should remain consistent. People can go to get a copy of my book by going to the URL, which is patientsforlifebook.com.au.